Good morning, and thank you very much for the introduction. Best achievement, though, was to be able to have 3 kids and 3 grandkids. So in a way, after contributing to the world fertility. After Professor Doherty's speech, of course, this is nothing. And however, I find myself in the difficult position of translating science, evidence, and the product of research and big brains into policy and into action. As you will see, we didn't talk before the session today, but as you can see, the theme for the G7, which Italy has the honor to preside this year, is in fact global strategy, the development of a global strategy for the mitigation of effects of climate change on planetary health, which is exactly what was addressed by Professor Doherty. So in a way, we try to act on the preventive side, although our feeling is that, as it has been said, it's just too late and we can only adapt rather than mitigate the effects. The rationale for this was to just observation. What happens on the planet Earth now, taking advantage of the hard work done by the commission called by Lancet. It's the Commission on Planetary Health that that works together with the other commission on climate change and tries to figure out what will happen tomorrow, what will happen in 5, 6, 10 years, what will happen on a 50-year plan. The basic of the discussions being that we work on the One Health approach as well as on the much more difficult achievement of putting health in all of government and all of society, which is one of our major challenge. As a matter of fact, not only my difficult time is in trying to translate into policy what science says, but also to rush and to rush fast whenever I attack tobacco industry and the pharmaceutical industries to let us work and let us survive with the challenges of tobacco consumption and others. The objective of the meetings in the G7 will have 2 major outputs. One will be the declaration of prime ministers that will take place in Taormina, Sicily, in May, at the end of May, next month basically, and a second major declaration of ministers of health of the G7, hopefully. So far we got support by 6 out of the 7 countries, and you can guess what the 7th country, which is not in agreement with global changes in environment and climate, may be. That will be a declaration of ministers in November this year from Milano. The objectives, as you can see, is a formulation of global strategy. This is involving the G7 countries, but it has an impact on the G20 as well. G20 this year is managed by Germany, and it has several issues which are similar to the G7 course of action. Hopefully, the G7, G20 will work hand in hand, and WHO and other international agencies will be supported for the implementation of whatever decisions may be in different areas and different fields, as you will see with the next slides. The methodology we have chosen is rather atypical for a G7 meeting, which is very much directive from top to bottom. We have tried to stimulate a bottom-up approach and try to involve scientists and researchers all over the world in trying to get an idea of what the expectations may be and what science can contribute and policy making can contribute in changing the way we work, the way we expect the entire business will work unless we take action now. We have developed a matrix, I will show you an example, and we will distribute a Delphi questionnaire in 2 steps. Do not be surprised if you receive our Delphi questionnaire in the next couple of months. We will request your contribution because your contribution will be critical in trying to set priorities for action. This matrix is considering the known climate drivers, different climate aspects that may interact with human and animal health. As you can see, this is a major list of the topics that we are addressing now: extreme events, physical events, heat or cold, events in different areas of the world, but also artifacts of air pollution. Air pollution is going to be identified as the 5th major risk factor for health after feeding, after nutrition, after obesity, after whatever you know is physical movement and so forth. But we also consider water access and waterborne diseases as a specific area of concern, the food system and nutrition by and large, animal health and the animal-human interface, as it has been said very clearly by Professor Doherty, that's one of the most critical aspects, but also other issues such as migrant flows. You know that Italy is the forefront of the migration wave in the Mediterranean area and in Europe by and large, as well as antimicrobial resistance, for which we do not have evidence enough now, but for which there is research going on that may support some conclusions on this. The Delphi questionnaire will be administered in 2 phases, as I said, and we will try to have as many respondents as possible, trying to get in contact with different aspects, different researchers, scientists from all over the world. This won't be limited to the G7 countries, of course. That will be a much larger consultation. Second phase will draw conclusions, and the issue here is to try to build scenarios for major policymakers to understand the implications and to try to develop policies. There can't be policies implemented by just one country. They have to be policies implemented worldwide and trying to work together, having some results very fast, unless otherwise we are lost, as I said, because we can't wait for 2030 to act. This is the way the matrix looks like. You can see stream events, artifacts, whatever the list of items I've listed here. Again, the aim is to build scenarios on the short term, 2020, on the medium term, 2030, when the SDGs will expire, and an action on the long term, 2050. This is an example of how the matrix looks like. This is, for instance, vector-borne diseases. As you can see, we look at exposure, what are the factors, what is the health outcome which is linked to that, what the statement of need, what should be done, as spelled out by the expert statement can be, and the action that we can derive from that, where the context is, and the background of documents and evidence that has been collected and can be produced so far, because we still need to persuade policymakers that we are on the right track and that we need to act. Water access and waterborne diseases, very much the same structure, obviously different evidence and different statements. Food system and nutrition, which is critical, as it has been said. Without food, we go nowhere. Without proper nutrition, we go nowhere, and we know that. Animal health, this is another critical aspect for which Italy is well known as having an inbuilt system that addresses One Health within the same ministry. Ministry of Health as an authority of moving and acting on human as well as on animal health. And as I said last night during a meeting, working on animal health is much easier than working with humans. With animals, you tell them what to do and they do it. Otherwise, you force them to do it and you achieve success. With humans, you got to persuade them, and most of the time, they persuade you that you were wrong. Migrants flow is something particular. It may be something that people do not consider as appropriate in the global climate change context because it's very much managed by criminal organization and human trafficking. But on the real situation, we know that drought, floods, wars, whatever you name it is there, is at the root of this impressive migrants route. We host now 500,000 people just in Sicily. These are the people we rescued at the sea in the last 2 years. And of course, we can't consider them as moved and managed by criminal organizations. These are human beings and they must be rescued. Thank you very much. This is, in fact, the documented situation of arrivals from 2013 when we started doing that until 2017. And unfortunately, Italy has been left very much alone on managing this particular aspect of human health. European Union, as we may say, is very reluctant to get involved in this, and member states are also extremely reluctant to support and to share the burden. These are the migratory routes that we manage. As you can see, moving by the sea is much more difficult than moving by land. You don't cross borders, you cross the sea. And the sea there is quite dangerous. And as a matter of fact, we estimate that 3 times the deaths from Ebola crisis are now in the Mediterranean. And of course, with the Ebola, we mobilize the world. With the migrants, we mobilize nothing apart from our country. And as a conclusion of this dramatic appeal, we all welcome you to Rome in 2020. We hope you will have a great time. For us, it will be a great time because after the G7 this year, we will have the Regional Committee of the European WHO Bureau next year. 2019, we will save our strength and we make, in order to be able to manage the challenge by the World Public Health Conference in Rome 2020, but we will assist you, we will welcome you, and we will be able to show you the beauties of our cities and country. Thank you very much.